Hello. All right, I'm going to say something a tiny bit controversial. Anki cards don't work. Okay. I need to clarify this statement. I am not saying Anki cards are just entirely a bad idea, but I am saying that they don't work in the long-term game if you are just memorizing facts. Those of you who follow my YouTube, TikTok, and Instagram channels know I provide a daily drill question, which is essentially an Anki Plus card. I say Anki Plus card because although the initial question is a bit surface, it tests one specific medical fact. I give additional information and explain the pathology and answer to the initial question. I do this because we can almost always answer a simple drill question. What's the diagnosis? What's the treatment? What's the complication or adverse drug reaction? Nevertheless, we don't always understand the pathophysiology. We don't always understand how the fact connects to the other aspects of the disease. For example, how is heterochromatin in the biochemistry section of first aid related to Turner syndrome in the pathology section? If you know the answer to this question, put it in the comments. If you don't, that's okay. I'll discuss it in a later video. Herein lies the dilemma between using Anki cards for memorization alone versus using Anki cards combined with additional learning and retention methods. Although Anki cards work for some, they must be supplemented by something else in order to maximize their efficacy. The best additional element to add to the learning process is the application of the information or facts. This means that whatever tidbits, facts, or minutiae you're required to memorize, it is imperative that you apply that information via active recall practice application. Hence today, we are going to do a PACE activity. I hear you asking, what is a PACE activity? It means practice applying content exercise. There are unlimited formats for completing PACE activities. To get some ideas about this, check out the free 100-page download in the description, which contains 20 free USMLE vignette-style questions in addition to active recall exercises, examples of PACE activities. Today's PACE activity will be a quiz. These quiz questions are related to the daily drill questions we provide in video short form content. So if you haven't seen the daily drill question videos, check out the playlist here. For those who have been watching the drill questions, these questions should be easy peasy lemon squeezy, as my son frequently says. Pause. If you're enjoying the content on this video thus far, make sure to subscribe to the channel and put the notifications on so you don't miss any of our future videos. Now back to our scheduled programming. When completing the quiz, daily drill question watchers should be able to come up with the answers without a ton of contemplation because they've already watched the videos, read about the additional concepts, and made some connections regarding the pathologies tested. In this video, you will practice applying that information to a USMLE vignette-style format. I put together 5 questions for today's quiz. The questions are timed, 90 seconds per question, because testing under timed conditions helps to simulate exam conditions. On average, you should not spend more than 90 seconds per exam question to make sure you get through the entire exam. The timer has been added to each question in the video to make this an easy exercise without any additional equipment required. The timer counts down, starting green, transitions to yellow, and ultimately red when you enter the last 5 seconds. Your time has expired when you hear the. If you haven't come up with an answer by the time the timer dings, pause the video before proceeding. To help challenge you more and avoid a spoiler in the video, the answers are not provided in the video. However, they can be downloaded in the link in the description and in the comments. Here are some recommendations for people who do not complete the questions at the 90-second mark. If you come up with answers quickly, play the video at a faster speed and mute the audio so you can get through the questions faster. If you are taking a little longer than 90 seconds, pause the video as needed to give yourself adequate time to process each question. I promise you that with regular practice, you will get faster, and do not let the utilization of the pause button discourage you. Please do me a favor and drop the word gotcha in the comments to let me know if this makes sense and help me with the YouTube algorithm so these tips can help other students. There's one more thing you will see when answering these quiz questions. You will not have the answer choices immediately available when the vignette is displayed.
What you talking about, Liz?
Why? Well, everyone who has worked with me one-on-one knows I train students to avoid relying on answer choices to answer multiple choice questions. Don't worry though. The answer choices will become available approximately 60 seconds into the timer, providing plenty of time for you to develop a prediction of the correct answer choice that you will look for. That pretty much wraps up the introduction to the quiz. Since this is the very first time I'm doing this type of format, I would really appreciate if you could give me some feedback in the comments. So, here we go. Ready, set, go.
Question number 1. A 35-year-old male presents to the emergency department with severe chest pain and dyspnea after a bout of heavy vomiting. The pain started suddenly and is localized to his lower chest and upper abdomen. He reports feeling a sharp stabbing pain that worsens with deep breathing. His vital signs include a temperature of 101 degrees Fahrenheit, blood pressure of 120 over 78 millimeters of mercury, heart rate of 115 beats per minute, and respiratory rate of 24 breaths per minute. Physical examination reveals crepitus on palpation of the chest and subcutaneous emphysema around the neck. Chest X-ray shows mediastinal air. The patient is otherwise healthy with no significant medical history. He is not taking any medications. Make a prediction. A. Acute pancreatitis. B. Acute myocardial infarction. C. Beer-Haave syndrome. D. Pneumomediastinum. E. Pulmonary embolism. Question number 2. A 5-year-old boy presents to the pediatric clinic with his mother, who reports that he has been experiencing recurrent infections and progressive developmental delays. The child has a history of frequent upper respiratory infections and skin abscesses. His mother mentions that he has had no response to several courses of antibiotics, and he has been experiencing increasing difficulty with motor coordination. On physical examination, the child has pale skin, light-colored hair, and a few hypopigmentation areas. Neurological examination reveals mild ataxia and decreased deep tendon reflexes. Blood tests show mild anemia, and a peripheral blood smear reveals large, abnormally shaped neutrophils with giant granules. Which of the following is the most likely diagnosis? Make a prediction. A. Chronic granulomatous disease. B. Chidiac-Higashi syndrome. C. Hyper-IgE syndrome. D. X-linked agammaglobulinemia. E. DiGeorge syndrome. Question number 3. A 22-year-old woman presents to the clinic for a routine checkup. She has a history of intermittent abdominal pain and has been experiencing episodes of nausea and vomiting for the past few months. She mentions that she also has a history of multiple episodes of bowel obstruction. Upon further questioning, she notes that her father had a history of colorectal cancer diagnosed at age 45. and her mother had a history of ovarian cancer. The patient denies any significant weight loss or blood in her stool. On physical examination, the patient appears well nourished, and there are no signs of acute distress. Her skin exam reveals multiple dark-colored macules on her lips, buccal mucosa, and fingers. Her abdominal examination is unremarkable, but she is slightly tender in the lower abdomen. Which of the following is the most likely diagnosis? Make a prediction. A. Familial adenomatous polyposis. B. Peutz-Jeghers syndrome. C. Lynch syndrome. D. Crohn's disease. E. Irritable bowel syndrome. Question number 4. A 45-year-old woman presents to the clinic with complaints of recurrent episodes of vertigo, tinnitus, and hearing loss in her right ear. These episodes have been progressively worsening over the past 6 months, with the vertigo lasting for several hours. She describes the sensation of whirling and reports that the episodes are associated with fullness in her ear. The tinnitus is described as a constant ringing. Her medical history is unremarkable, and she's not currently on any medications. She denies any recent head trauma or ear infections. She is a non-smoker and drinks alcohol occasionally. Family history is notable for her mother having similar symptoms, which were diagnosed as inner ear problems. On examination, she has normal vital signs and no signs of acute distress. Neurologic examination reveals no focal deficits, and her hearing is diminished on the right side. The Dix-Hallpike test is negative, and Romberg test is normal. Pure tone audiometry confirms sensorineural hearing loss in the right ear. Which of the following is the most likely diagnosis? Make a prediction. A. Acoustic neuroma. B. Vestibular neuritis. C. Benign paroxysmal positional vertigo. D. Labyrinthitis. E. Meniere's disease. Question number 5. A 32-year-old man with a history of HIV presents to the emergency department with a 5-day history of fever, dry cough, and progressive shortness of breath. He is a known HIV patient with a CD4 plus T cell count of 150 cells per cubic millimeter and has not been adherent to his antiretroviral therapy for the past several months. On physical examination, his temperature is 101.3 degrees Fahrenheit. Heart rate is 110 beats per minute. Blood pressure is 110 over 70 millimeters of mercury, and respiratory rate is 22 breaths per minute. He appears moderately ill and is using accessory muscles for breathing. On auscultation, there are fine crackles in both lungs. Chest X-ray shows diffuse bilateral interstitial infiltrates with a characteristic hazy appearance. Laboratory findings include a normal white blood cell count and a mild hypoxia with an oxygen saturation of 90% on room air. Which of the following is the most likely diagnosis? Make a prediction. A. Tuberculosis. B. Acute bacterial pneumonia. C. Pneumocystis pneumonia. D. Cytomegalovirus. Pneumonia. E. Idiopathic pulmonary fibrosis.
You made it through your first PACE video. This PACE activity can complement any Anki card preparation you're doing. I stand by my initial statement. Anki cards alone will not earn you top scores, but when added to active recall activities, the sky is the limit for exceptional USMLE scores. I want to take a moment to thank one of my students, Sierra, for inspiring this video. Sierra, You already know I'm filled with gratitude for you allowing me to be a passenger on your medical journey. We at MedUPTIck welcome feedback and guidance on how we can better serve you. Tell us what you really think in the comments. Do you like this new format? Do you hate it? How can we make it better? What would you like to see on this channel? Until we meet again, continue to elevate your clinical mastery, and thanks for making it to the end. Bye for now.